I'm here with Dr. Lori Stevens. She's a holistic dentist here in Gainesville, Georgia. How are you doing today?
Doing great. Thank you, Brooke.
Do you want to tell us a little about yourself?
Well, sure. Um, I've been in dentistry. This is my 46th year, and I was a hygienist first, and then went to the Medical College of Georgia and graduated in 1988 from dental school, and had some clinic experience, some residency experience, and then built this office, and I've been here 35 years here in Gainesville.
That's great. I did notice your YouTube channel has a different name than Dr. Lori. What's the story behind Dr. Lolly?
Well, that's funny. My husband's grandmother called me Lolly instead of Lori, and it's just I've had nicknames similar to that all my life, and so the Lolly just kind of stuck.
Oh, that's sweet. Okay, so I have some of the most common questions that you get here at your office, and one of those being second opinions on root canals. So you want to tell us a little about root canals?
Yeah, so a root canal procedure has to happen when you have a nerve in a tooth that dies, or the tooth has to be extracted, but the dead nerve has to be taken out because the dead nerve will be a cause of infection in the body. And many diseases are an effect of that low-grade infection of an infected tooth. And the only thing worse than an infected root canal tooth is an infected tooth that never got treated. So the options when you have a tooth that has like a throbbing toothache that's from some damage to that nerve, and once the nerve is past the point of healing, you either have to take the nerve and the tooth out, or you do a roto-rooter down through the tooth and just get the dead nerve out and leave the tooth in the mouth for an attachment. So that's we call it root canal, but that's really a root canal therapy is what when you do that treatment down into the root to take a dead nerve out.
Okay, so then how would I know if I needed a root canal?
Well, on an x-ray, it's really simple. If you imagine an x-ray with the roots of the teeth and then a black balloon on the tip of a root is a typical abscess, because infection coming out the tip of the root is very acidic, so it kills the bone right around the tip of the root. And on the x-ray, there's nothing to stop that x-ray going through the bone, because the bone's got a hole in it, and that's why you get that black balloon look at a tip of a root. So that on an x-ray is a picture most people can imagine in their head. Oh, I've seen an x-ray that looks like that. Or people who've had root canals. Yeah, I remember they showed me that x-ray and said this one's got an abscess on it. And so that, of course, is an absolute reason to treat the tooth, either root canal or extract, and it depends on the health of the person and how many teeth they have. And there's, every root canal's they're not all one size fits all. They're not all alike. So it depends on how they're done. And the latest technology is to use a photona laser, like photon, but it's spelled with an F, a photona laser. And a photona laser can now just take out just the damaged part of the nerve and leave, if there is some of the nerve that's still healthy, especially in children who break front teeth, permanent teeth, then somebody who uses that technique can take out the damaged nerve, leave the other part of the nerve. A lot of times they'll take some blood out of a vein, spin it down and get the growth factors and try to regrow the rest of that nerve, especially in children who have traumatic injuries that break teeth. But the photona laser is a really important part of a really good procedure for a tooth that has had nerve damage. Ozone is another, I think, indispensable therapy. And ozone is just oxygen molecules slammed together, and then they want to be O2. So if you slam so much oxygen together, it can go all the way to O21. Well, oxygen with 21 wants to go to 20, wants to go to 19, and so on and so on. So you get these oxygen singlets. So if you think of hydrogen peroxide and how it bubbles and the oxygen comes off, that's kind of like ozone. Not exactly, but kind of like ozone. But ozone therapy's been around a couple hundred years, and it's ozone, you hear it in the weather, the ozone layer, that's God's air cleaner. Well, Ozone can be administered in the head and neck region for dental procedures in 3 different ways. We can inject it around an infected tooth, and that'll help. It's kind of like shocking a swimming pool. It doesn't fix the problem permanently, but it'll make it look good, make the swimming pool look good for the weekend. The ozone will clean those bugs out, actually better than taking antibiotics for an abscessed tooth. Ozone actually will help in the diagnosis too, because if a tooth is hurting and it's infected, ozone will help you determine that it's not, the origin of the pain's not coming from TMJ or sore muscles or grinding your teeth or a cracked tooth or something like that. So ozone's a really good therapy and a good diagnostic tool. And then the other thing, when in the therapy for root canal, a microscope. So specialists who use and actually look through a microscope to be able to see the tooth in much bigger than it really is. They can look at that nerve tissue and see what part's damaged, what part's not damaged. They can look for cracks and micro cracks in the tooth, and the anatomy of the tooth is very small and very complicated. So anybody that's looking to get a root canal therapy for whatever reason, those 3 things would be my criteria before you go. You want to know, do they have a photonal laser? Are they using ozone? And are they using a microscope to look through? And the one person that I know that comes right to mind is Val Cantor, and she's in LA, and she does a lot of those kids with broken teeth and try to regrow that nerve. And also, I've had some patients actually go to Val, and they've had very good results. And she's doing the latest technology. Now, there are other people, but I just can't tell you right off the top of my head who they are. But if somebody's looking for something like that, we can surely help you find somebody like that.
Okay. Yeah, and so then I have one more common question here. If I were to get a crown, do I have to have a root canal?
A lot of crowns and root canals are treatment planned together. I test every tooth before I treat a tooth for anything. I test it with an electric pulp test. So if indeed the tooth is dead and it has no electrical response, everything in your body works on electricity, every thought, every motion, movement, every anything you do, your body it all works on electricity.
Right.
So before we work on any tooth, if it structurally needs a crown because it's broken and weak structurally, that's what a crown does. It reinforces the tooth, kind of like if your house is leaking, you need to find the leak in the roof. That's kind of like a crown. It's a structural thing on the outside to hold it all together. But one note about crowns, I don't do crowns because it cuts all the enamel off. I use a partial crown, or the term is onlay as a more conservative. I want to save all the enamel on the tooth I can, so that can be a whole nother discussion there on crowns. But so if a tooth needs something structurally, that's the holding it together, kind of like a roof covers and holds together. If the tooth is abscessed and you find it on the x-ray, and maybe I had a family member who had an abscess on a tooth, never had a toothache, didn't have any idea her tooth was abscessed. I just found it on a series of x-rays we were taking, and digital x-rays is a whole nother discussion we need to have about digital x-rays.
Okay.
And the homeopathics that negate the radiation. But anyway, so if a tooth is abscessed, if it's a back tooth and you do the root canal and keep the tooth, it is more likely to crack or break than a front tooth. So the rule is, if a back tooth gets a root canal, structurally it probably needs an onlay or crown or something to strengthen it. Anterior teeth typically they're not at any larger, they're not at any more danger to break. So anterior teeth, like maybe you get hit with a softball in the front tooth and it breaks it, and it breaks it in the nerve, you have to have a root canal. They can fix the tooth without a crown, then structurally, you might be okay with just a filling or fixing the broken part or whatever. But chewing teeth on the back, then typically the rule is to crown those if they need a root canal. Now, if you've been told you need a crown and they're just going to do the root canal because the old filling in it's deep or whatever, I go back to that electric pulp test that I use to test the nerve. I want to know if that tooth is dead before I work on it. So if the tooth tests dead, then the answer then is you got to take the dead nerve out either by root canal or extraction. So that's a convoluted answer to your question, a lot more than you really had, but they don't go together. We need to separate fixing something because it's structurally broken and fixing something that hurts. Now, your question is very good because many people come to me and go, hey, I want a second opinion about this because this tooth hurts. They say I need a crown on it. Well, if a tooth hurts, you got to figure out the origin of the pain and can you fix the pain before you work on it.
Right.
Because if you can't fix the pain and they're still going to have a throbbing toothache after you put a crown on that tooth, you've wasted that patient's money and time because he's still got toothache.
Right.
So crowning a tooth will never fix a toothache. So I want to make that really clear because there's a lot of confusion about, well, let's crown it and see if it feels better. Well, I'll go into a little bit more detail. So if a tooth is chewing sensitive occasionally and it's like, oh gosh, I bit something and it was hard, it was tender, and it was tender for a couple of days, but then I don't notice it again for 6 months, and then it does it again. So that may be a crack in a tooth that the old silver fillings and mercury fillings we put in, we had to cut a hole bigger at the bottom than at the top, so it tended to crack teeth. So sometimes if you've got a tooth that's got a crack and that crack gets flexed open, it'll be sensitive for a little while because the bacteria can get from your saliva down in that tooth and the nerve is offended. And then if you don't if you don't hit it so that it cracks it open, but just occasionally, it won't bother you very much. But long story short, if you've got a crack in a tooth, you might need an onlay structurally to hold those pieces of the tooth together so that you don't have the tooth flexing. If a tooth flexes, and some people go, oh, well, it was chewing sensitive till this part broke off. Well, that's why it hurt, because the tooth was flexing and then that part broke off. Now, if it broke in an advantageous way, then you can just put an onlay on it, or even sometimes a filling or something to repair that structurally. But restorations are for structure. Root canals are for pain or dead nerves. So they're for different reasons. So you got to separate, why are you doing this, and if you do this, is it going to fix the problem? Okay. So finding out the origin of the toothache that's the reason you got to do a little more testing. I have some people say, oh, well, the endodontist, the root canal dentist just put cold on it. Well, I want to know a little more information than is it just cold sensitive? I want to know, does the nerve in that tooth fire? Does the nerve in that tooth work? If you flip a light switch and the light bulb doesn't come on, you got two things that might be wrong. The light bulb might be out, or the switch might be bad. Right. If you put that little tiny bit of electricity that you can't even feel on your finger on the tip of that little electric pulp tester, which is nerve, that's a clinical name for the nerve in the tooth is the pulp. So if you test that nerve and it doesn't fire, then that's going to be like a dried up raisin. Your grape nerve has now turned to a dried up raisin, dried up nerve. It's going to eventually abscess. So still a long answer, convoluted answer for your question. You got to be sure that you can know the origin of the pain, to know that it's coming from the tooth before you do any treatment. And you want to know if the tooth's alive or dead before you treat a tooth.
Okay, well, thank you for clarifying that.
Okay.
So, would you say all root canals are bad?
Well, no, not necessarily. But all root canals, I think, should be done by people who have adequate training. And that doesn't necessarily mean they've got to be a specialist, because some general dentists do lots of extra training in certain things. But if I needed a root canal, I would only go to somebody who just does root canals all the time, because they're complicated. Some of them, the teeth have 1 or 2 or 3 roots typically, and in those 3-rooted teeth sometimes have 4 or 5 nerves, and sometimes teeth have got extra nerves, and so they're complicated. And for somebody who just does that all day, every day, with that photona laser and the ozone and that microscope, your outcome is going to be exponentially better than somebody who's doing it without that top-notch equipment, and somebody who does, you've heard that saying, be a jack of all trades and a master of none. Well, I don't mean to say that dentists are that, but I'm just saying having been in dentistry for 46 years, having done root canals, and I don't and haven't in a long time, I realized, even with a lot of extra training that I took, that was something I felt like if there was going to be done, it needed to be done by the specialist. And now with these new, I say new, ozone's been around 150 years. Microscopes have been, they've been, I think, pretty commonplace in endodontist offices for probably 15, 20 years now. And then that photonal laser's been around long enough to know that I don't want anybody doing a root canal on me or my family without those 3 pieces of equipment.
Okay, good to know. So how would you care for a root canal once you've received one?
Once you have one, well, let's widen that question to, if say you got a limited number of teeth and you got one that hooks your partial sits on it, and it has now shows an abscess on x-ray. So there's no question you got to either take the tooth out to get that dead nerve out, or you got to do a root canal to get the dead nerve out. So for pre-op, before you go have the root canal done, ask somebody who's got that photonal laser and ozone and the microscope. And in our situation, I have a guy here in Gainesville who has the laser and the microscope, and I do the ozone. But we would pre-op treat that person with ozone. So an ozone injection around an abscessed tooth is better than the antibiotic prescription. And so we want to clean up the microbes, the infection in that bone before we work on that tooth. That calms the tooth, calms the inflammation, infection in the bone. The procedure's going to go better. And then if you can use the ozone water during that procedure, like a molar tooth has 9 miles of water pipes in a molar tooth, 9 miles. Mm-hmm. Well, that ozone is a 3,000 times better disinfectant than bleach, which is the typical solution. We wash teeth out on the inside to sterilize the inside of the tooth. But ozone is 3,000 better times disinfectant. So if you can wash that tooth out with ozone during the procedure, that's even better. And so that's pre-op and operative to use ozone. And then also for maintenance, say you got a partial sitting on one tooth on the lower, on one whole side, maybe you just got that one tooth. You want to take extra good care of that tooth and be sure that I personally don't like implants. I've spent all the money to get the training and buy all the equipment and all that, and then I decided I just didn't think titanium in somebody's jawbone was a good idea. And then they figured out titanium rusts, and then they've got the zirconium salt implants, which is a salt of zirconia. So they look like porcelain, and still a lot of people are not candidates for implants, and that's a whole nother discussion there.
Right.
So if you've got a tooth that's critical to hold a partial or something like that, you want to be sure you take, and even if you have a root canal that you just have had for a long time, and maybe you've heard you better get your root canals out, but you don't really know, so you can treat root canal teeth with ozone. And so that will 2 to 4 times a year is a typical, just like shocking a swimming pool. You can just clean all the bad bugs from around that tooth, because the reason root canal teeth harbor bad bugs, just in general, even if they're not symptomatic, you don't have a toothache, it's not throbbing or anything like that. Because there's no electricity in that tooth, it's a low voltage area, and so the pathogenic bacteria like those areas. It's the same as if you've got a artificial knee or a ankle injury or a C-section scar. Those are low voltage areas, and we know from research that over 800 species of bad bugs can live around a root canal that looks perfect, feels perfect, and has no symptoms. And so, just because you've got a root canal, to save a tooth, it needs maintenance, okay? Whether you've had it a long time, whether you have symptoms or you don't have symptoms around it, it needs that maintenance of an ozone injection just to clean up the bone, because those bugs are going to go hide there, okay? And then some maintenance on if you're just having a root canal done, you're just going to continue that maintenance. Say you had an abscess and you had it treated. Well, you want to do a little maintenance afterwards to just keep that bone cleared from infection, and then 2 to 4 times a year for like, say maybe somebody's had a root canal for 15 years and never really thought about it. That's a good one to just, when you go to the dentist, at least twice a year, get some ozone around it to just clean those bugs up so that you're not harboring bugs like, say, on a breast meridian. I've seen in my practice, I've seen multiple people, women who had breast cancer on the side, particularly a lower tooth, that either had a root canal that was bothersome or had a tooth that was, one lady had a filling when she was a teenager and it was bothersome for 25 years, but it never really bothered her enough to have anything else done to the tooth. It just was, consistently bothersome. So that's a warning sign for people who've got a tooth that it just bothers me just 2 or 3 times a year. And they say, oh, it's been 20 years. That's just 2 or 3 times a year it bothers you. So it's good to have those symptoms sometimes if something is bothersome, to get it checked out. So again, a long, convoluted answer to your question. Did that answer your question?
Yes,
okay? All right.
It did. So I don't really have any more questions. Is there anything you want to add about root canals before we close?
I think just the fact that people, a lot of people are, it's easy. There's so much information out there, so many podcasts, so many documentaries. There's so much information out there that you kind of got to be, which is one of the reasons that I want to help people kind of be a dental detective. There's so many nuances. There's so many facets of each decision and each diagnosis that I'm working with a couple people now. One lady's quit her job and she's had so much tooth pain for like 6 years. She can't work and she can't, access the kind of things I'm talking about. Like, she's been looking for somebody to do ozone in her area and there's not anybody. And so there's so much confusion because every root canal is not bad.
Right.
Every root canal that was done prior to ozone and laser and microscopes is not bad. It's just a case-by-case situation, and it depends a lot on the person's microbiome, because if they've got good gut bacteria, then you can fight off these opportunistic infections that live and grow in low voltage areas. And so just like, people have to, if they've got a artificial knee or artificial hip, they've got to, pre-med for some certain procedures and things. Mm-hmm. But the main thing is just knowing your situation and what your situation calls for. And that's what I hope that these podcasts will help. And we welcome people to contact us with other questions, or if I've confused people, then that's what we want to do. I've had a lot of experience on all sides of the chair, being a patient, being a dentist, being a hygienist, and then, just all these years of seeing lots and lots of different, and every week that I practice, I see something I've never seen before.
Right.
It's just, our environment's changing, people's health is changing, our immune system's just not as good, our gut bacteria is not as good as it used to be. So it's just a lot of different factors may help make the decision of what choice you take and what treatment you take. And do you, our immune system, by the time we're 50, that's pretty much a consensus. Our immune system can't handle the drain of that low level chronic infection that these root canal teeth harbor. So if people are getting ozone, that's going to eliminate that low level chronic inflammation and help a lot of people. And some people are like, I've got so many health problems, I don't want to take any chances, I want these root canal teeth out. And so and I used to take a lot of them out. I did a lot of surgery, and you got to be careful even taking them out. You got to do it the right way, and you got to disinfect all that bone, and you got to treat the tissue right. You can't get it too hot. You can't pull on it too hard, and you got to be good. Tissue management is so important, especially with bone. And like I say, those root canal teeth harbor lots of bad bugs around them. So pre-op, operative, and post-op ozone, I think, are essential. And so I think that's the key, is we need to get more people, more practitioners offering ozone, because
Right.
it's such a good alternative, especially to antibiotics.
Okay, well, good to know. Well, thank you, Dr. Lori, for all this information about root canals. Is there
Good.
anything else you want to add?
Just if you want to post where for them to ask more questions, and then
Yeah.
we'll be glad to answer whatever questions y'all have. Shoot them, and we'll make some more podcasts.
Yes. Thank you.
Thank you.